M9. Treat an open abdominal wound and eye injury. Step 1. Check for both entry and exit wounds by sitting the casualty up and rolling him up to the side. Step 2. Position the casualty on back, flex knees, and turn head to the side, keeping airway clear in case of vomiting. Step 3. Expose the wound. Pick up organs that are on the ground using a clean, dry dressing and gently place on abdomen without touching them. Do not probe, clean, or try to remove foreign objects from or push organs back inside body. Step 4. Apply a moist, sterile abdominal dressing. If an object is extending from the wound, do not remove it. Place as much of it and wrap around as much as possible without dislodging or moving. Do not place wrapper over object. Ensure dressing is large enough to cover entire mass of protruding organs or area of the wound. If large enough to cover affected area, place sterile side of plastic wrapper directly over wound. Place dressing directly on wound or plastic wrapper if used. Do not apply pressure or expose internal parts. Tie dressing tails loosely at casualty's side or secure hooking ends of closure bar into bandage. Repeat if 2 dressings are needed. Ensure that ties of additional dressings are not tied over each other. Ensure dressing is secured firmly enough to prevent slipping without applying pressure. Step 5. Treat for shock. Loosen binding equipment and clothing and prevent the casualty from getting chilled or overheated. While performing this step, degradable state, the casualty is making vomiting sounds. Roll to the side without causing further injuries. Degradable state, vomiting is stopped. Return to supine position with knees flexed. Resecure bandages and blanket if needed. Step 6. Treat lacerations and contusions of tissue surrounding the eye. Close the lid of the affected eye. Do not exert pressure or manipulate the globe in any way. Cover the injury with moist, sterile dressing to prevent drying.
So that's one spot. We have 2 over here.
Cover the torn eyelids with a loose dressing. Place field dressing over eye pad or dressing.